ਸਾਹ ਰਹਿਣ ਲੱਗ ਪਿਆ ਸੀ, ਨਹੀਂ ਕੰਮ ਸ਼ਾਮ ਨਹੀਂ ਸੀ ਹੁੰਦਾ ਮੇਰੇ ਕੋਲ। ਕਾਰੋਬਾਰ 'ਚ ਬੜਾ ਫਰਕ ਪਿਆ ਸੀ, ਕਾਰੋਬਾਰ ਬੰਦ ਹੀ ਹੋ ਗਿਆ ਸੀ, ਖਤਮ ਹੋ ਗਿਆ ਸੀ, ਘਰ ਦਾ ਬੜਾ ਮੁਸ਼ਕਿਲ ਗੁਜ਼ਾਰਾ ਹੁੰਦਾ ਸੀ ਪਿਆ।
Unfortunately, healthcare in Pakistan faces tough challenges. We merely spend 3% of the GDP on health, and with the devolution of powers to the provinces, system is much more complicated as compared to what it used to be before. 60 to 70% of the Pakistan, the brunt of healthcare is borne by the private sector.
There are many areas which are difficult to reach, both for us to reach there to find the patients and to treat them, and also for the patients to come to us into bigger cities for evaluation and treatment.
ਤਕਰੀਬਨ ਮੈਨੂੰ ਵੀ 22 ਸਾਲ ਤੋਂ ਇਸ ਮੰਡੀ 'ਚ ਕੰਮ ਕਰ ਰਿਹਾ, ਮਜ਼ਦੂਰੀ ਕਰ ਰਿਹਾ। 2022 ਤੋਂ ਪਤਾ ਲੱਗਿਆ ਮੈਨੂੰ, ਫਿਰ ਮੈਂ ਚੈੱਕ ਕਰਾਇਆ ਮਹੱਲੇ ਦੇ ਡਾਕਟਰ ਕੋਲ। ਉਹਨੇ ਕਿਹਾ ਕਿ ਤੁਸੀਂ ਜਾ ਕੇ ਟੈਸਟ ਕਰਾਓ। ਫਿਰ ਮੈਂ ਟੈਸਟ ਕਰਾਉਣ ਗਿਆ, ਉੱਥੋਂ ਦੱਸਿਆ ਵੀ ਤੁਹਾਡਾ ਹਾਈਪਰ ਸੀ ਹੈ।
Majority of the Pakistan, the people here are daily wagers. If they do not work for that day, it may translate that they may not have the money to feed their family. We started a liver foundation in Gujranwala, and it was with the help of philanthropists. We successfully managed a lot of patients, and initially I thought, well, this is what we needed to do. Ran it successfully for 6-8 years, and then suddenly I realized that nothing is changing. You treat one patient, there are 2 sitting outside, you treat 2, there are 4 sitting outside, you treat 4, there are 8 people sitting outside. We were not getting over the disease. The solution lies in out-of-box solution, I must say, because the current scenario is unable to meet the health demands of the Pakistani people. When I met Sanjeev Arora first time, and immediately I knew this is what I need to do.
After retirement from my job in a public sector hospital, I was missing the opportunity to teach and to treat patients in large numbers. Non-alcoholic fatty liver disease को treat नहीं करेंगे।
ECHO, we reached out to everybody. We reached out to primary care physicians. We got hold of experts who came on ECHO, and directly they interacted with the people here in Pakistan.
Technically speaking, lifelong. This is an excellent platform for teaching and training of those people on whom we find difficulty in reaching. So even in far-flung areas, we can equip the medical professionals and healthcare workers to manage the complex diseases by giving them simple messages.
We use technology to leverage the scarce resources. Then there is a system of case-based learning. It's to share best practices, and then there is a system where you can, which helps you monitor the outcomes.
So these are screening things that we do all the time and talk about.
ਇੱਥੋਂ ਨਾਲ ਹੀ ਥੋੜੀ ਦੂਰ ਹੀ ਹੈ ਰਾਈ ਹਸਪਤਾਲ, ਉੱਥੇ ਜਾ ਕੇ ਫਿਰ ਮੈਂ ਡਾਕਟਰ ਕੋਲ, ਅੱਛੇ ਡਾਕਟਰ ਕੋਲ ਗਿਆ, ਉਹਨੇ ਫਿਰ ਮੇਰਾ ਅੱਛਾ ਇਲਾਜ ਕੀਤਾ।
मैं क्योंकि एज अ जनरल प्रैक्टिशनर काम कर रही हूँ, बीइंग फीमेल एंड मैरिड, में अपना जो है ना कैरियर मज़ीद इसको परस्यू नहीं कर सकी। मैंने कोई प्रॉपर स्पेशलाइजेशन नहीं की, तो मेरे पास क्योंकि कोई प्रॉपर इस तरह से ट्रेनिंग नहीं थी, इसलिए मेरे लिए ये प्रोग्राम जो है वो बहुत हेल्पफुल रहा है।
मेरे मरीज़ कुछ करीब से आते हैं, कुछ 5 से 6 किलोमीटर दूर, कुछ इससे भी ज़्यादा। मरीज़ जो अगर किसी कंसल्टेंट के पास जाते हैं तो एक तो उनको वक्त चाहिए काफ़ी, और दूसरा गाड़ी चाहिए जो रेंट पे ली जाए, और उसके बाद पैसे 15 से 20 हज़ार तो कम से कम लग जाता है पेशेंट का।
We reached out to hundreds of doctors across Pakistan in our hepatitis echo. We trained them in treating the disease, whom to treat and whom to refer.
मैं अभी भी अपने पेशेंट्स को कंसल्टेंट के पास ज़रूर भेजती हूँ, बिकॉज़ मैं एक मेडिकल ऑफिसर हूँ और मेरे पास अभी उतना नॉलेज या तजुर्बा नहीं है। तो इस वजह से जहाँ मुझे लगता है कि मेरे मरीज़ को मेरे अलावा किसी कंसल्टेंट को देखने की ज़रूरत है, जो केस मुझसे हैंडल नहीं हो रहा, मैं अपने पेशेंट को ज़रूर रेफ़र करती हूँ पेशेंट की बेहतरी के लिए।
At PARSA Echo Pakistan, we have been very fortunate to have dedicated partners and some collaborations which proved to be very useful.
PKLI thought it was need to improve palliative care services in Pakistan that are nearly non-existent, and that is why we collaborated with PARSA Echo and Project Echo to launch our palliative care program. We were able to provide patient services at doorsteps, at peripheries, and it has really helped ease patient suffering towards the end of life.
I think one of the reasons why we are so committed to supporting Project Echo is also the scale of the ambition Project Echo has itself. It's not limited to a particular disease. We spoke about hepatitis, it's an ideal application. But Echo, there's not a field out there where the Echo model could not be applied for improving patient outcomes.
Before we move forward, we have to As the Director of Operations at PARSA Echo, my focus lies in establishing a robust platform that unites healthcare providers, community members and stakeholders to enhance outreach and knowledge exchange. Serving as Pakistan's inaugural super hub, we are committed to amplifying our organizational capacity and visibility. Our strategic efforts involve resource mobilization, extensive training, partnership expansion, and wider impact across the nation.
For CME credits, please contact me.
ਇਲਾਜ ਤੋਂ ਬਾਅਦ ਮੈਂ ਕਾਰੋਬਾਰ ਕਰਨਾ ਪਿਆ ਵਾ ਤੇ ਬਿਹਤਰ ਹੋ ਰਿਹਾ ਹੈ।
Echo is not only about medical education. Globally, Echo is very much into education, environment. And so we are working with various government departments, and we are trying to make some Echo programs and see how we can engage them.
Echo as a model can bring this healthcare to all parts of Pakistan, so everybody gets best practice care. I'm grateful to Dr. Asad and his team for bringing Echo to Pakistan. Truly a labor of love. My vision is that with Echo, every citizen of Pakistan gets wonderful health care regardless of where they live and their socio-economic status.
We have done the hard work, and inshallah it will go on.
I would like to welcome you all to another Echo session in series of hepatitis Echo. It's in collaboration with Pakistan Society.